Good evening. I'd like to discuss a patient scenario with you. This is a 78-year-old Hispanic male that presents with his son. The patient was in the garage and fell off a step stool, changing a light bulb. He landed on his left side. He denies loss of consciousness. He admits to 4 out of 10 pain on his left lateral side. It sounds like he hasn't been trying anything to manage his pain at home. The son is also concerned that the patient has been having an ongoing cough for the last week. This cough is productive in nature. He has tan sputum. The patient admits to tiring out more easily. This patient has a prominent medical history with diabetes, hypertension, COPD, HLD, CAD, PAD, CKD, CHF. He's on a lot of medications. To name a few, he's on metformin 500 milligrams. He's on lisinopril 40 milligrams, amlodipine 5 milligrams. He's on a few medications for his BPH, Hitrin and Flomax. This patient is quite active at home. He is retired though. He was a mechanist. He has 2 kids. Unfortunately, he is recently a widow in the last 3 months as his wife has passed away. Denies smoking, tobacco, illicit drug use. He is a social drinker. And speaking with the patient, he admits to feeling fatigued. He admits to shortness of breath and productive cough, as I had mentioned. He is having that left hip pain. Denies use of a walker or a cane at home, even after the fall. He denies weakness or headache. On exam, there's contusion on his iliac crest. Patient doesn't appear to be in any distress, but is having some slight guarding on his left side. He's normocephalic on presentation. He has some facial bruising. Also on exam, I noted white exudate on the back of his throat. He is 90% on room air. He's got coarse lung sounds bilaterally. Cardiac-wise, S1, S2 are heard. He does have 2+ bilateral ankle edema. Musculoskeletal-wise, he's strong throughout. As I mentioned, he is a little guarded on his left hip. I'm concerned that this patient has streptococcal pharyngitis related to cough and white exudate. Also want to rule out this patient for community-acquired pneumonia. I think he's having a CHF exacerbation as well due to the 2+ bilateral ankle edema and shortness of breath. And lastly, I'm concerned that this patient has a hip fracture due to the HPI and physical exam. I'd like to start the patient on amoxicillin 500 milligrams twice daily for 14 days. I'd like to start the patient on a diuretic 20 milligrams PO daily. I'd like him to follow up with his cardiologist as well next week. I'm ordering a rapid strep antigen test. Additionally, I'm ordering a chest x-ray, hip x-ray, CBC, CMP. I'm going to advise the patient to ice his hip, limit strenuous activities. He can take his naproxen that he's currently taking right now for pain and inflammation. I want to see the patient back in the office in 1 week. Patient advised to go to the ER if he develops any severe shortness of breath, chest pain, fevers, chills, rigors, and that's my assessment and plan. Thank you.